After a patient has undergone an acne treatment protocol and has improved the look of their skin, i.e. the pustules and the papules and the inflammatory nodules have all settled down, we can then look at what we can do for the acne scarring. So it's important to get the patient on board with using some products at home. So a derma roller is a good thing to have once your acne is under control. It's a way of microneedling your own skin. You can use it in conjunction with vitamin C serum and retinoids, and it alone, used every night, like your toothbrush, will improve your scarring and the texture of your skin. This can be a tricky thing to get boys to do, but we try and get everyone to give it a go and just think of it like a routine you get into. That alone can help people with their scarring and their texture of the skin. The most obvious answer for acne scarring in a younger patient who perhaps wouldn't tolerate too many needles in their skin is Dermapen. So Dermapen's a mechanical device we use usually around sort of 2 to 3 sessions about a month apart, depending on the degree of acne scarring, to try and improve the texture and increase the collagen. Most teenagers will tolerate Dermapen treatment even without topical local anaesthetic, usually done in conjunction with having their parent in the room at the same time. It takes about 8 to 12 minutes to do an entire face, and it's a very well tolerated treatment by teenagers as young as 12. If a patient is an older acne patient who perhaps has more the female adult onset acne, the cystic type of jawline type acne that keeps coming and going, we'd really like to encourage them to use platelet-rich plasma in conjunction with the Dermapen and with LED following the treatment. The combination of all those treatments really does make a huge difference in someone's potential to develop further scarring and improve the scarring they've got. Some acne scarring is not going to respond to the mechanical devices we have alone. So Dermapen, PRP, LED can only do so much. If you've got significant ice pick scarring or extremely recalcitrant, prolonged acne scarring, it may be more amenable to the device technology we have available, like radiofrequency needling, laser ablation techniques.